Thousands of Missouri children may lose their health care. A federal program that provides funding for low-income families has expired.
It's called the Children's Health Insurance Program, or CHIP for short. 5 on Your Side's Marianne Martinez spoke with one of the many families in the area who rely on it. She joins us now with more. Marianne.
Okay, and Mike, Congress allowed the CHIP funding to expire at the end of September, and without a renewal, money for Missouri kids is dwindling.
So it's frustrating, it's stressful.
Alicia Deal is a single mom with 3 kids. Her 14-year-old son, Romante, has a severe form of autism.
My son requires medication. He requires intensive therapy and counseling.
He is able to get those services because of a combination of Medicaid and CHIP, the Children's Health Insurance Program. But without it, Alicia says her son faces a bleak future.
My son is good as dead, and that's just true.
Thousands of Missouri kids rely on CHIP for basic services like checkups and vaccines and more specialized care.
It's especially a lifeline for families with children who have special health care needs, such as disabilities, such as autism.
Kate Casper is with Generate Health, an organization that promotes healthy birth outcomes. She says if Congress does not renew the program, Missouri could run out of funding by early next year.
Particularly here in St. Louis, this is an issue because we have a health crisis when it comes to racial health disparities.
Alicia says without health care, she would have to take her children to the ER.
He's just going to be having a lot of episodes that's going to require him to go back to the ER, psychiatric hospital.
And she has a message for Congress, who can decide whether or not to renew CHIP.
You in there to work for the people, and don't forget that.
Now, we contacted both Missouri senators today, and they say they both support CHIP. But at this point, it's a question of when Congress decides to act on it. Kay?
All right, thank you, Marianne. Now, the CHIP program covers 9 million kids in the U.S. 650,000 of them are in Missouri. That includes every single child in the state's foster care program. So what happens to these kids? Many of them just won't have health care. They won't have coverage for preventive care or vaccines. And if they get really sick, they'll probably end up in the ER.